Okay, another Plastic Surgery Channel roundtable. Dave, Matt, I got a very interesting subject for us today, and it's about patients and the internet and where they're getting their information and what that leads to long term. Because there was an article that came out that kind of described the fact that patients get a lot of their expert information from the internet, and in doing so, it sets all kinds of expectations that often the plastic surgery can't meet. So, Dave, what do you think about that? What do you think about what you're seeing with your patients?
Yeah, absolutely. I mean, people get so much of their information from social media now, from the internet. So I think people are coming in with really unrealistic expectations for them. You know, I think that's why it's so important that when people come in, that they, you come up with a custom plan for them. They don't understand what you can and can't do as a surgeon or as a doctor. And so if they come in where their expectations are totally malaligned with what you can give them, then of course they're never going to be happy. Right. Because if you don't set the expectations ahead of time, how could they ever be happy, right?
Matt, are you seeing a lot of that, or are you having any issues with your patients as they come in and the information they bring with them from the internet?
I'm seeing a lot more of that. Patients get information from the internet, but now social media itself, being able to search through social media, has eclipsed that. So they're coming in almost with their own surgical plan sometimes.
Yes.
And then you're in a position where you're trying to sort of bridge the gap between what the clinical reality is and what this patient wants, not to mention that you still don't know if you're going to be able to meet their expectations. So you have to be very careful. You don't want to have an unhappy patient or have a patient that is just underwhelmed by your results.
Yeah.
Right. So, yeah.
I think the answer to this is more expertise out in front of patients, right? And so the more content that we can put out there that's from experts would be better.
Well, it's tricky because oftentimes expertise and results and long lists and data and charts and things like that is boring.
Yes.
And a patient doesn't want to see that. They want to see that quick Instagram post that shows, this completely crazy before and after in only 2 minutes.
Yeah.
But on top of that, nobody is going to post their bad results.
Yes.
Nobody's going to post their average results. So what people are seeing is everyone's best results, best work. And so people don't understand that that's marketing.
Yeah.
From all of us,
Yes.
on both sides. And so people's again, going back to expectations, I think people's expectations are not in line with reality.
As always, the internet and all that you can get through the internet, social media, et cetera, has a positive, because it's definitely taken plastic surgery out of the closet and made us more available and more exposed, and they've learned more about it. But there's a danger to that. For the Plastic Surgery Channel Roundtable, thank you.